I was noticing your Twitter feed, and you were flagging the fact that Michael was just reporting on that two hospitals in the Toronto area, Brampton Civic and William Osler, have declared a code orange. Now, for anyone who's not a healthcare worker, what does that mean, and how common is that?
I'm going to try hard not to cry on this interview because this is really emotional right now for me, because last night when I got that message that Brampton Civic had called the code orange, my heart broke. My heart broke really hard because I know what that means. That is a disaster. A code orange is called because of a nursing shortage. I want people to know it's because of a nursing shortage. It's not because we don't have enough porters in the hospital. It's not because we don't have enough cleaners. It's because we don't have nurses in the hospitals. And this is not used very often. I think the last time we saw code orange called in one of the hospitals was during the disaster that happened, unfortunately, in downtown Toronto, where we had a mass casualty of a truck driver driving into numerous people. So I want people to understand that this is a crisis that's going to take lives. It's going to cost lives. So right now we have people that are going to die because of a nursing shortage. So
and you make
I
that
really
clear,
want to
how
make
your
that
heart
clear.
as you get emotional, you wrote that too, your heart is beating fast, and you say it is so unsafe. Can you explain that, why you say that? Because I'm interested in what you're seeing and what you're experiencing in the ICU that leads you to say that.
So last month in December, I did pick up quite a few shifts because I knew January was going to be hard. And I knew schools were going to close. So my question is, as an ICU nurse going to the bedside, I don't have all the data that epidemiologists do have. I see patients at the bedside. If I knew that it was going to be so bad in January, how come the government didn't know? I say this because I see patients who've had surgeries being canceled. And unfortunately, we know that racialized people are so impacted in this pandemic. Why do we have a code orange called in Brampton Civic? Why at William Osler? These are neighborhoods that are so congregated. These are areas where we have racialized communities. We have so much societal and systemic inequities that is really impacted. Why do we have a code orange called in these neighborhoods? Unfortunately, as an ICU nurse, I go to different hospitals and I see it firsthand. I see what's going on. Patients are sick. Patients are sick, and we have people coming. So people are saying Omicron is mild. There's nothing mild about this virus. There's absolutely nothing mild about the variants, because we have people with surgeries that are canceled, heart surgeries are canceled, cancer surgeries are canceled. People at the bedside are suffering. Nurses are breaking down. I'm taking a break right now. I'm at home because I knew schools were going to close, and I need to be at home for my daughter. So unfortunately, I'm at loss for words. I really am.
It's a very vivid portrayal that you're creating for us, helping us understand what it is that you're living every day, you and nurses right across the country. When you say about people in the ICU beds as you are at the bedside, I mean, are these people who are getting enough care? Are there people who are in the ICUs when they shouldn't be? What is the reality for the patients?
Patients are not getting the quality of care that they deserve because we don't have enough nurses. I worked last week, and we had, at one point, we had 9 ICU nurses for a unit, and they had to call different agencies to send in staff. We're supposed to be staffed up to 22 ICU nurses in that case. What that means is that if you're in the ICU on life support machine, or your loved one is, they're supposed to be looked after by one nurse. And now we've seen one nurse look after 3 of those kinds of patients, and they're even talking about team nursing. That's a recipe for disaster. That's absolutely no solution. Doris Greenspan, the CEO of the RNAO, that represent over 50,000 nurses in Ontario, has been calling for the Ford government to repeal Bill 124. Nurses are quitting because of this bill. People are going to different sectors because enough is enough. We're tired. You can't have nurses working 16-hour shifts in a row. Last week, nurses are being guilt-tripped to work for 16 hours. These are parents. A lot of nurses are women with children. So
Yes.
these are people that have to go home to their loved ones, but they're forced to stay at the bedside to take care of people.
So I
I
just
want
want
people
people to
to
understand
understand that.
in the rest of Canada, as we speak nationally, Birgit, Bill 124 is the bill which limits nurses' income, public sector income, to a maximum of 1% for this moderation period of 3 years. So it suspends collective bargaining and holds those
Correct.
wages at that 1% level. And there's been a fight about that ever since it was enacted in 2019. And the concern was that nurses would leave at that time, and then obviously the pandemic has exacerbated the situation. I'm just wondering, there was a response from the government yesterday, an announcement that non-emergent procedures would be postponed, an announcement of closing schools, an announcement of all sorts of restrictions being brought back again. What do you think of the measures and whether they will make a difference in your hospitals?
What I heard in the announcement was that schools were going to close. I didn't hear about measures that are put in place for schools to go back to be reopened safely. I didn't hear about free N95 masks for teachers, for educators, for daycare workers, for students, or for every single Ontarian that will not be able to afford it. I did not hear about free N95 masks for disabled people. The disabled community has been neglected in this pandemic. I didn't hear about free testings. As a matter of fact, we're going to suppress reporting COVID cases in schools. What that means is that I will not know if my child or a classroom is in an outbreak because of COVID. Why are we doing this? So we have 2 weeks, although we've had 2 years, the government has had 2 years to plan and prepare. As an employee, if I fail this much, I lose my job. What I'm saying is we have 2 weeks to put things in place. Classrooms, I'm not going to pretend that classrooms are going to be smaller, but at least we can have HEPA filters put in place. I was in a town hall yesterday with Dr. Fissman, Dr. Kaplan, and some students' voices, and the same things. You need to listen to people that are working in the community, to doctors, to nurses, to teachers, to education workers, daycare workers. These are the people that are actually interacting with people in the community. This virus is highly contagious. So we need classrooms to be safe. That means HEPA filters, enough testings. We need vaccines for teachers. We need vaccines for students. People need to get vaccinated. I'm trying to even send out the message in my local community that don't get tired of getting your booster shots. Don't say this is another dose. No, it's the same thing. Some people have to have their blood pressure pills every single
Yes.
day. We have to do everything we can.
Birgit, can I just jump in there? It's so interesting as I listen to you react as a healthcare worker, an ICU nurse, but also as a parent, as a mom, as an Ontarian, both aspects of this touching you in all facets of your life. And you mentioned that town hall. I'm going to have to conclude on this point because it was interesting as you spoke. I was hearing and reading that you actually issued a bit of an invitation to the Premier, to the Health Minister, other cabinet ministers to join you on a 4-hour ICU shift. I don't know if
Yeah.
you've had any response yet, but what would they see? What would you like them specifically to experience and to see as a message from you?
So yes, I want them to come when I arrive on the unit, first thing at 7 a.m. in the morning. I'm walking into a code blue. That's usually the case these days. You have tons of, respiratory therapists, physicians, nurses, all in one room doing chest compressions. That's how our shift starts a lot of times these days, which is so unusual. So why is this happening? People are not getting the care they need, of course, and that's why they're having things like a cardiac arrest. I know there are other situations, but we don't have enough staff. I want them to come in and see how you walk in and they tell you that, oh, Birgit, you're supposed to have one patient, but unfortunately, X didn't show up because they're sick or they're tired, and you're going to have two patients. And I want them to see how for 7 hours I'm unable to use the washroom because I'm so engrossed in caring for my patients and making sure I titrate those medications and patients are like on the verge, on the brink of actually dying. I want them to see how when I go into the nursing station, nurses are crying because new grads don't have the support, and old and more experienced nurses have left the bedside. There's so much. I think every politician should have a rotation in our ICUs at this point of the pandemic. I think that will definitely bring things into perspective.